Good afternoon, everyone. My name is Angelina Taylor, and I'm a member of AARP Michigan's Thought Leadership Council. And today I'll be your host for this event that has been specially planned for those of us that are caring for a loved one. Today's event is part of our Ask the Doc series, where we invited top experts on health topics important to people as they age to share their insights and answer your questions. It's a great opportunity to get the information you need from real experts. So far, we've talked about weight loss options like Ozempic and intermittent fasting, and pushed comfort levels with some frank questions on sex and aging. And we're not done yet. Next month, on April 25th, we'll be discussing the truth behind cannabis in healthcare. And on May 29th, we'll be talking about dementia, something that you won't want to miss. You can register for any of these events using the link in the chat. Best of all, these programs are free. But today, we're here to talk about caring for a loved one, a topic that is personal to me. When my father, a veteran of the United States Marine Corps, had a massive stroke, I unexpectedly became his full-time caregiver, and it hasn't been easy. As part of my journey, I started searching for resources to help me, and I came across the Elizabeth Dole Foundation, which provides support for people caring for service members and veterans. In fact, I'm now a caregiver fellow for the Elizabeth Dole Foundation, where I can help pay it forward because truly, at some point, this affects all of us. Former First Lady Rosalind Carter once said that there are only four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. That's the reality. So let's talk numbers. Nationally, there are more than 48 million Americans who provide unpaid care to an adult loved one, including 1.73 million family caregivers right here in Michigan. And one thing that all of them have in common is that they put family first. They shoulder a heavy lift, helping with just about everything, like medications, doctor's appointments, meals, bathing, dressing, chores, finances, grocery shopping, transportation, and much, much more. On average, they spend about 20 hours a week on caregiving and $7,200 per year out of pocket to help with their loved one's expenses. None of it is easy, but knowledge and resources can help ease the burden. So let's get started. To take us through this conversation, we have here with us today Julie Lowenthal, a program and advocacy specialist at Area Agency on Aging 1B. Julie's expertise in the caregiving program development and advocacy, where she brings a strong background in public health, social work, particularly in aging services. She'll let you know that she is a dedicated and experienced advocate for expanding caregiver support initiatives like the Caregiver Respite Voucher Program and advancing policies that ensure caregivers and seniors have access to community care solutions. We've asked her to kick things off with her vast knowledge on family caregiving, but then we're going to turn things over to you, our audience. We've reserved the majority of our time for your questions. So if at any point you have anything that you want to say or ask a question, just drop it in the chat and we'll do our best to get to everyone's questions. And now it's my privilege to turn things over to Julie Lowenthal.
Thank you so much. Hi, everyone, and thank you for joining us today. Like Angelina said, my name is Julie Lowenthal, Planning and Advocacy Specialist at Ageways Nonprofit Senior Services, also known as Area Agency on Aging 1B. And I'm honored to be here on behalf of the agency, which is a nonprofit senior service organization dedicated to supporting older adults, adults with disabilities, and caregivers just like you. Today, we're going to be discussing some key tips, tools, and strategies for caring for an aging loved one. Caregiving is both rewarding and challenging, and my goal is to provide you with some practical steps and resources and insights to help you navigate this journey more effectively. Our team at AARP, following the presentation, will also drop a PDF file into the chat, and that will have some expanded resources for you to be able to use later on. Most older adults prefer to remain in their homes or community settings rather than move into a nursing facility. Making that possible, though, requires careful planning and an understanding of the available resources out there. As a caregiver, having open conversations with your loved one about their needs, preferences, and concerns, such as housing, medical care, and financial planning, can help prevent difficult decisions down the road. Establishing a strong support network early on is really essential. And this includes healthcare providers, legal advisors, and community resources that can help you navigate the complexities of aging. It's also important to have those legal documents in place, such as a power of attorney and a living will, to ensure that decisions align with your loved one's wishes and to prevent added stress during emergencies. Additionally, caregiving responsibilities can be demanding both physically and emotionally, and recognizing the signs of burnout, such as stress, anxiety, and social withdrawal, allows you to take proactive steps before it affects your well-being. Seeking respite, delegating tasks, and accessing support groups can help you maintain balance while continuing to provide the best quality of care. And I want you to remember, taking care of yourself is not a luxury, it is a necessity. Caregiving can be overwhelming, and many caregivers don't know about the programs and resources available, and many try to manage everything on their own. You may be juggling work, your own household, and even children while providing that care. And this can lead to stress and exhaustion and even family conflicts. One major challenge that many caregivers have expressed is the impact caregiving has on relationships. Providing care for a loved one can shift family dynamics and create tension among siblings and other relatives. Clear communication and shared responsibilities can help reduce those conflicts and ease the caregiving burden. Finances are another major concern expressed by many caregivers. Most caregivers spend out of pocket on medical expenses, home modifications, and daily care needs. So exploring financial assistance programs, insurance benefits, and government services such as the Medicaid waiver program or a respite care grant can help reduce those costs. Additionally, caregiving is physically demanding. Assisting with mobility, hygiene, medical tasks can take a toll on your health. So seeking help through home health aides, physical therapy, or even respite services can provide much needed relief and prevent injury or burnout. With over 52 million Americans providing care for chronically ill or disabled loved ones, you're not alone, and understanding available resources and taking steps to share responsibilities can make this journey a little bit more manageable. I now want to dive a little bit deeper into some steps that you can take to care for your loved one. Providing the best care starts with assessing your loved one's needs and being prepared for future changes. Educating yourself about their medical condition can help you plan ahead and make informed decisions. Consult healthcare providers and organizations specializing in their condition to better understand symptoms, treatment options, and disease progression. Groups like the Alzheimer's Association Foundation of Michigan can provide valuable resources and support for caregivers of individuals with dementia. You can also explore local services that can ease daily caregiver challenges. So programs like Meals on Wheels, transportation assistance, and personal care services can help ensure seniors receive the proper nutrition, mobility support, and hygiene care. Additionally, there are online tools from the Family Caregiver Alliance and the National Institute on Aging offering caregiver-specific education and guidance. And finally, using caregiver assessment tools like checklists and symptom trackers can help monitor changes over time, track medical needs, and prepare for doctor's appointments. Staying informed allows caregivers to adjust care plans as needed and prevent any unnecessary hospitalizations down the line. The next step you can take is finding the right support system. So there are many organizations out there that provide essential services to ease the challenges of caregiving. Local area agencies on aging, like my agency, Ageways, connects caregivers to resources, while disease-specific groups like the Alzheimer's Association offer specialized support. Faith communities, senior centers, and veterans organizations also provide valuable assistance. For example, faith-based groups may offer companionship visits, meal programs, respite care, and transportation, as well as home modifications like granite bars and ramps. One such organization that you might want to look into would be Catholic Charities. Senior centers can also provide, is another great resource in which you can try to utilize. And they can provide adult day programs, wellness classes, legal and financial guidance, including Medicaid and estate planning. And many also offer caregiver support and case management. So if you would like to find your local senior center within your community, you can visit ncoa.org. And then you can look it up based off of your exact geolocation. And then if we have any veterans in this group, veterans may qualify for aid and assistance benefits to help with home care or assisted living. And the Veterans Directed Care Program allows them to hire their own caregivers. The VA also offers caregiver support in transportation and housing assistance. In addition to all the resources I just mentioned, online caregiver forums and support groups offer emotional support and advice from those with shared experiences. To find your local area agency on aging, you can visit eldercare.acl.gov, or you can call a 1-800 number and they can help you find that as well. You can also visit different organizations like Caregiver Action Network, AARP's Caregiver Resource Center, and the National Alliance for Caregiving. Taking advantage of these services can make caregiving more manageable and ensure that your loved one receives the best possible care. The next step that I would like to talk about is understanding the legal and financial aspects of caregiving. Planning ahead can provide security for both caregivers and their loved ones, reducing stress and uncertainty. Several key considerations can help families navigate these responsibilities more effectively. First, you need to ensure that essential legal documents are in place. A power of attorney, or POA, allows a designated person to make financial and legal decisions on behalf of the care recipient, while a living will outlines medical treatment preferences in case they cannot communicate for their own wishes. In Michigan, while a living will is not legally binding, a durable power of attorney for healthcare is recognized and allows an appointed individual to make those medical decisions. Fortunately, creating these documents does not necessarily require an attorney. Free resources are available through MichiganLegalHelp.org and the Michigan Office of Retirement Services. Another important financial tool is going to be a caregiver contract, also known as a personal care agreement. And this formal document outlines the caregiver's responsibilities, schedule if a family wants to do compensation for those people, and also ensures clear expectations and financial security. Such agreements can be particularly helpful if a caregiver has reduced their work hours or left employment to provide care. And additionally, a properly secured agreement can aid in Medicaid planning, preventing payments to caregivers from being considered gifts that can ultimately impact eligibility. If you would like, you can consult with an elder law attorney so that you can make sure that all of these agreements are well in place. Caregivers should also be aware of policies designed to support them in the hospital setting, such as the Caregiver Advice Records Enable, or CARE Act. Enacted in many states, this legislation requires hospitals to document a designated caregiver, notify them upon a patient's discharge, and provide instructions for post-hospital care. These measures help family caregivers prepare for the transition home, reducing hospital readmission and improving patient outcomes. Financial assistance can also help ease caregiving costs. So the Medicaid waiver program, for example, allows states to provide home and community-based services such as personal care and home modifications to individuals who might otherwise require institutional care. And additionally, respite care grants like those available through the National Family Caregiver Support Program provides temporary relief for caregivers, allowing them to take a break. Michigan residents can also explore these options through the Department of Health and Human Services, as well as their local area agency on aging. Just by calling the resource center at your local area agency on aging, they're able to connect you to the various resources that would be available to you, especially for home and community-based services. To manage medical expenses and long-term care costs, caregivers should consider using budget tools or consulting with financial planners specializing in elder care. Budgeting tools help track expenses, manage future costs, while also financial planners can offer strategic strategies for managing assets, insurance, and care expenses. Additionally, services such as home health aides, homemaker assistance, and respite care can provide critical in-home support available through home care agencies, nonprofits, and government programs. By being proactive in addressing these legal and financial considerations, as a caregiver, you can navigate these responsibilities with greater confidence in ensuring that your loved one receives that best possible care while also protecting your own well-being. The next step I would like to talk about is things for you in terms of making sure that you stay the most proactive caregiver you can be. So caregiving is an incredibly rewarding, but it also can be rather overwhelming, and no one can do it alone. And luckily, you don't have to. Seeking help isn't a sign of weakness. It's actually a step towards better care and well-being for both you and your loved one. In-home care services can provide essential tips, assistance with hygiene, homemaking services, and help, as well as companionship services offer social interaction. And respite care allows caregivers to take breaks and prevent that burnout. If you are hiring help, vet the providers very carefully. Check their experience, certifications, and references to ensure that they are the right fit for you and your loved one. Family and community support is also very essential for many families. Family and friends can share responsibilities like meal preps, transportation, and companionship. Having a shared schedule to help reduce tasks and reduce stress would be helpful. And accepting help isn't a burden. It actually strengthens the care that you are providing. Another tip for caregivers can be home modifications and technology. So simple home adjustments like grab bars and improved lighting enhance safety, while assisted devices promote independence. There is also technology, newer technology out there that can help automate the medical dispensing, as well as voice-activated assistants and caregiving apps that can all help manage daily care effectively. And lastly, taking care of yourself is just as important as caring for your loved one. Caregiver burnout is very, very real. Exhaustion and social withdrawal are just a few signs that stress is taking a toll. And without self-care, it can be harder to provide the quality care that you and your loved one need. But I want to be very clear. Self-care is not selfish. It's actually essential. Small daily breaks, mindfulness, or even physical activity can make a real difference. Support groups and educational workshops offer connection and guidance, reminding caregivers that they are not alone in this journey. And if stress becomes way too overwhelming, professional counseling can provide valuable coping strategies. Caregiving was never meant to be done alone, and seeking support is not giving up. It's actually creating a sustainable approach that benefits both you and your loved one. So if you are struggling, please reach out. You deserve support just as much as the person that you are caring for. Prioritizing your well-being will allow you to continue providing compassionate and effective care. Thank you so much. And I do want to open it up to questions.
Much, Julie. And as Julie mentioned, we're going to open the floor for questions. I want to remind everyone that if you want to ask a question, you can put it in the chat and we'll do our best to get to everyone's questions. So our first question comes from John. I would like to learn what documents we need to have in place medically. Mom and dad are in their 90s.
So as I mentioned, having a living will and the power of attorney will be essential. The CARE Act does help you in terms of making sure that when your parents are getting discharged, but making sure that all of those documents are also in a folder by the door, so that let's just say your parents are living alone and the emergency services do come into the home to take care to take them, transport them over to the hospital. They're able to find those documents really, really quickly.
Perfect. Next question from Karen. I need to know how to get affordable in-home caregivers.
That is a really tough question to answer, Karen, and I apologize. So there, unfortunately, we do have a direct care work shortage going on in the United States right now. I do know that federally, the ACL, Office for Community Living, is working on some sustainable approaches to ensure that we can, have more of a streamlined process to get people into that workforce. But right now, it is, supply and demand issue. So I wish I could give you a better answer in terms of how to find affordable, but I would recommend contacting your local area agency on aging, and they can actually talk you through maybe some of the different options that might be available. There are programs like the Community Living Program, which are those that are not Medicaid eligible, that can help with that. Or if your family is Medicaid eligible, then there is the Medicaid waiver program as well.
Thanks, Julie. Our next question comes from Cindy. Is there a kind way to convince a parent that it's time to give up driving when they don't want to?
Driving in retirement is one of the toughest conversations that you will have with your parents. In Southeast Michigan, there is a resource called myride2.org. It is operated through area agencies on aging, but it is a federally funded program. And it offers tips on that website on how to have those conversations with your loved one or a parent about when it's time to give up that driving. I would say that be mindful that giving up driving for a lot of older adults is difficult, mainly because it's a loss of independence. And they're not ready to give up that just yet. So also making sure that, they're getting regular eye checks, to make sure that their eyes are still functioning. And then also just, if you want, you can also go and get like cognitive tests and have their doctor also have those conversations with them. It might be helpful coming from them as well.
Thank you. Have 2 questions from John. You know what? Second question from John. Sorry. New question. What would make someone Medicaid eligible?
So for the Medicaid waiver program, the asset limit is about $2,800 a month in monthly income. And then in the state of Michigan, we just increased the asset limit from $2,000 up to $10,000. So that would make them for the Medicaid waiver program eligible. But I would contact your local waiver agent. So in Southeast Michigan, it would be Area Agency on Aging 1B or AgeWays, as well as MORC also provides that care. And they can actually walk you through all the steps to make sure that you are eligible for that type of program.
We have a question from Eleanor. Is a power of attorney document enough to speak to agencies like Social Security, Medicare, long-term care, medical insurance, etc., or do I need to get authorization to speak from each and every agency?
Unfortunately, I am not an attorney, so I would actually consult a legal aid service. So there's Elder Law of Michigan that can provide you with exactly which documents you would need. However, I do believe, based off of an attorney friend of mine, that a power of attorney should be enough. But again, I would just consult with a free legal aid service and call them, and they can give you that answer directly.
Thanks. Next question. I feel completely overwhelmed and exhausted. I don't know how I can keep doing this. How can I get help?
Find a support group. So some of the things that you can do is begin by reaching out. I know I sound like a broken record, everyone, and I apologize, but begin by reaching out to your area agency on aging within your area. And they can provide you with caregiver support. I know through my agency, we offer health and wellness programming. So there's a great program called Powerful Tools for Caregiving. And every caregiver that I've talked to that has left that program has actually said it was one of the best things they ever did for themselves. It is a 6-week, hour-and-a-half a week course on essential tools that a caregiver can do, as well as offers a small support group of other caregivers. We also have another program called Caregiver Coaching, and it's a one-on-one peer support program for family caregivers. So they get to talk one-on-one, whether it's once a week, whether it's once a month, it's really up to that caregiver and the coach that they're paired with. But they get to have a conversation with someone who understands what they're going through. Most of the coaches in that program have been caregivers themselves.
Next question. My dad has dementia, and lately he's been getting really angry and aggressive. How do I handle that?
Behavioral changes like aggression can be symptoms of dementia progression. So educating yourself through resources like the Alzheimer's Foundation of Michigan, and consult his healthcare provider to rule out any like additional medical issues that might be going on. But most importantly, try to stay calm, redirect attention, and create a predictable routine. For many people with Alzheimer's and dementia, having a very predictable routine will help them stay calm. And then there are support groups for dementia caregivers that can also provide strategies. There's also memory care cafes that frequently go on. I know in Saline, they have a really great memory care cafe where they even do movie nights for caregivers and those with dementia and Alzheimer's.
Thank you. This is a question that has hit home for me and a few other friends that I know that are caring for others. My siblings don't help at all with my mom's care, and I'm getting resentful. How do I get them more involved?
That's a tough one because family dynamics is, I think, stressful even in the best of times too, especially when you have childhood trauma also playing a role. Consider holding a family meeting to openly discuss responsibilities and your needs. You can suggest specific ways others can help, like managing finances, taking on a weekly task, or even offering a respite here and there. And if your siblings are really against trying to help in any way, you might just have to accept, unfortunately, like their limited ability in order to do that. And while that's not easy to do, and it might cause some resentment, that's when I would maybe recommend talking to a professional and getting a professional therapist to kind of help you get some coping skills for your siblings.
Wonderful insight. Thank you, Julie. We have a question from Daxaben. What was the name of the first resource you mentioned in the second to last question in regards to resources for caregivers?
The last question. Sorry, I'm having trouble trying to figure out which question this is coming from.
I'm not sure if they're able to clarify in the chat. We can circle back to that one. Let's see. Next question from Lori. My dad sleeps a lot and misses his meds. How can we be sure to give them to him?
First, I would actually talk to his, I guess this question is kind of twofold, because if he's on hospice or in palliative care, then I would actually talk to his nurse that comes in through those organizations to kind of figure out what's the best tools. If your dad isn't on any of those, isn't on hospice or in palliative care, first I would check with his doctor and maybe get some tests done to make sure that there's nothing else going on. But you can also, wake him up in those moments just to make sure that he gets his meds. I know in nursing homes we do crush. They used to crush the meds and put them in applesauce, and then wake up wake up the loved one in the home, and then provide them with the meds through the applesauce. But again, talk to the doctor before crushing them, just to make sure that it doesn't have any adverse effects in terms of crushing versus not crushing.
Thank you. We have a little bit more clarity on the previous question. So what was the name of the first resource you mentioned, and the second to last question in regards to resources for caregivers regarding the caregiving coaching?
So there was 2 programs at Ageways, my agency. The first one is Powerful Tools for Caregiving. I know all area agencies in the state of Michigan do offer that course, and it's a 6-week course, hour and a half sessions each, once a week. Some areas offer virtual as well as in person, and it offers a small support group as well. And then for caregiver coaching, my agency specifically does offer that one. I don't think any of the ones in Southeast Michigan do, other than us. And it's a one-on-one peer support program for family caregivers.
Thank you, Julie. Okay, let's see. This one's a good question. I really need a break, but I don't know how to get respite care. Where do I start?
So most of the respite programs are operated through the area agencies on aging. In the state of Michigan, we have the community living program, and then there's also the Medicaid Michigan, the My Choice program, or the Medicaid waiver program. And then those agencies also offer various respite type grants through some of those as well. So you can go to your local area agency on aging, talk to a resource specialist. So the nice thing about area agencies is that you are able to connect with the person on the other end of the line. And you don't necessarily have to call them and say, hey, I need respite care. You can just call them and they can do options counseling with you. So kind of walk you through what's going on and have those conversations to try to dig deeper. And then they'll be able to connect you with the various resources that are available, including respite care. At my agency, we do have a program called the Caregiver Respite Voucher Program. So it's a free $575 to allow family caregivers to access some in-home respite services.
Thank you. Next question from EC. Do you also have resources for New York residents? I notice most resources are for those residing in Michigan.
So I do know that there are resources. I'm in the state of Michigan, which is why I know a lot of the resources in the state of Michigan. So anyone on here that's not from Michigan, I do sincerely apologize. But area agencies on aging were enacted by an act of Congress in 1972. There are 650 of us across the United States. And so there will be one in your region. And in the chat, the AARP team should have put in a way so that you can a link so that you're able to find the local area agency on aging within your area. The Office for Aging in New York is also in the chat.
Thank you. Question from Eleanor. I'm in Florida. Can my caregiver get a coach through Ageways? Is there a charge?
So in the state of Florida, I would actually call to find out. There is no charge for the program, but in the state of Florida, I'd actually, again, call the Office of Aging in your region to see what programs they have to offer. Because all of the area agencies are independent nonprofits that all operate across the same network, it might be difficult unless either the caregiver or the care recipient have a resident within our region. But we do all work very, very closely with each other. And so if you did call us, we can also connect you with the right place and find the right resource for you.
And then what did you just mention? Caregiver Respite, the name of the agency.
So in Michigan, there's the Community Living Program and then the Medicaid Waiver Program. Medicaid Waiver Program is across multiple states, and then most states I know New York has one for sure, and Florida does too, a version of what the community living program would be, which are those that are not Medicaid eligible. And then and within those two programs, there are respite specific programs. And then there's also quite a few of the agencies are starting to implement various caregiver respite programs. There's also the National Family Caregiver, the National Family Caregivers, and they can also provide you with some resources to find the right respite care.
Thank you. Lori is asking, how long should we let the loved one sleep? Should we wake him up, and if so, when?
I would consult with your doctor on that. I think it really just depends. If the medication has to be given on a schedule, then making sure that you can wake them up on that schedule would be essential. But if it's something that can wait until they wake up, then you can wait. But again, consult with your physician or your loved one's physician on it, just to make sure. Medication can be really finicky, and you don't want to mess around with medication or anything like that. So always just have a conversation with the doctor or the nurse at the doctor's office so that they can give you the right instructions.
Thank you, Lori. Here's a great question. I'm trying to juggle caregiving and my full-time job, and I feel like I'm failing at both. Do you have any advice?
Balancing both roles is incredibly hard. So first, I would explore whether your employer offers flexible hours or family leave. A lot of employers nowadays are looking into implementing caregiver programs. So I know, for instance, Microsoft, some of the other big organizations are starting to implement specific caregiver support programs, as well as caregiver family leave into their leave policy. They're also looking at how to manage those flexible hours with family caregivers, because a lot of times caregivers can't leave, have to be in the home to help with their loved one. So just talk to your supervisor. And if they are giving you a hard time about it, then go and talk to HR and have a conversation with HR. So making sure that you always have the support of HR. That is what they're there for, is to make sure that you have the support you need. And then also talk to your friends and family and see if anyone is able to help you in any way that they can.
That's very wonderful advice. Thank you. Another question that kind of ties into that one. Are there any tax breaks for family caregivers? I'm spending a lot of my own money on my dad's care.
Not federally yet. I know that last year there was a bill that was introduced to try to get family tax credits for caregiver specific. I know that if you have a child, you get tax credits there. I know various states are trying to implement caregiver tax credits. California did for sure. Hawaii has a caregiver tax credit, and New York also has one. And then Michigan is looking at implementing one in the next couple of years.
Perfect. Thank you so much. Okay, we have a question from Karen. Love the resources, but can you give program resources that can be found in all of the states? I live in Illinois, so all of the resources in Michigan won't help some of us.
So if you look at the PDF that was dropped in the chat, I did provide minus the legal aid, and I'm happy to connect with you and give you the legal aid in Illinois. But a lot of the national organizations that I provided in that PDF are for national groups that can then connect you to all of your local agencies as well.
Perfect. Thank you so much. I think we have time for a couple more questions. Did anyone want to add any additional questions to the chat? Oh, Eleanor is asking, can Julie please provide her email contact info?
I am happy to provide that to anyone that is looking for it. And AARP of Michigan, you guys are more than welcome to put that into the chat.
Let's see. My husband has fallen a couple of times at home. What are some simple things that I can do to make the house safer?
So start with grab bars in the bathroom, better lighting, and then people don't realize this, and actually I didn't realize this until recently, but there's a lot of tripping hazards if you have like the rug to tile. So making sure that those are really smooth transitions, using non-slip mats. And you might also want to consider home safety assessments by an occupational therapist, or any other type of organization like that. You can contact your local agencies. You could also contact Catholics, different Catholic or faith-based organizations can offer those services in your area, and making sure that all of those things are essential. And then if you are not home, I know that more recently, there's, with the use of technology, family caregivers have been using, for spouses anyways, cameras in the home. So kind of like that Ring indoor camera, in order to just kind of keep an eye on their loved one and know about the movement if they have to step out for a moment. You can also look at getting one of those fall buttons. That will be really helpful as well.
Perfect. Thank you. This one's a good question. My mom wants to stay in her home as long as possible, but I don't know what kind of help is available. What are my options?
So look at different home and community-based services. Catholic Charities does offer a home and community-based service. Area agencies are the ones that implement a lot of the home and community-based services. But the biggest thing that I would recommend is actually assessing whether or not your mom is safe to stay in the home, and living independently. There are programs out there, like the ones I have mentioned, that can help people stay in their homes as long as possible, and help with the financial burden of making sure that that is possible. But if they're not safe to be in that home, then that might be a conversation of, a senior community setting where she can still live independently, as well as, so that she still has that support, but not necessarily living with anyone else. Always talk with the doctors, and like your medical support staff, to make sure that it's also safe in terms of that.
Perfect. Thank you so much. For our potential caregivers or those who have not yet started caring for their loved ones, what can they do if their parent refuses to go to the doctor, even though they know that there's something wrong?
That's a tough one. People are stubborn. Start with maybe having a conversation with the doctor. You can set up kind of a lot of doctors nowadays are incorporating family caregivers into the care plan, as well as into the care team, where that wasn't the case about 10 years ago. And so consult with the doctor about having those conversations, as well as just talk to the doctor about what's going on. They might be able to provide you with that. They might be able to provide you with some guidance on it. If the parent has Alzheimer's or dementia, Teepa Snow offers a lot of really great resources. And you can just Google her, Teepa Snow, Teepa, and then last name Snow. And her website offers a lot of really great resources for family caregivers.
Perfect. Thank you so much, Julie. Well, thank you all for joining us today. If people are still looking for more information, please visit our caregiving page at AARP or the local Michigan resources at aarpmi.org/care. It looks like we're out of time, so we'll cut their questions for now, but you can feel free to reach out through the website as well for additional questions. Please join me in thanking Julie Lowenthal for joining us today. And as we mentioned earlier, the Ask the Doc series is happening every month through May. Our next one is on April 25th, where we'll explore the truth behind We'll explore the truth behind cannabis in healthcare, and then we'll wrap up the series on May 29th when we discuss dementia care. These are all free virtual events where you can get to ask the experts your questions. The link to register is in the chat. And again, we thank you all so much for coming. Have a wonderful day.